Welcome to today's OR Today webinar. We are excited for today's presentation featuring Sharon Greene-Golden, Manager of Sterile Processing at Adventist Healthcare, Shady Grove Medical Center. OR Today would like to thank our sponsor, OneSource. The OneSource document site includes the most comprehensive online collection of IFUs and service manuals. There are 5 databases available covering surgical instruments and equipment, tissue and implants, dental, and facilities maintenance. For more information, visit www.onesourcedocs.com. Today's webinar is eligible for 1 continuing education hour by the California Board of Registered Nurses. You can obtain your certificate by completing today's post-webinar survey. The survey will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your CE hour, and you will be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. As I mentioned earlier, Sharon Greene-Golden is our presenter today. Sharon has an extensive experience in healthcare, beginning as a labor and delivery technician and then an operating room technician, before transitioning to sterile processing and inventory management and serving as a CSD Manager. Sharon's a consultant regarding sterilization processes at facilities across the U.S. and abroad, and she's participated in multiple volunteer missions to Bangladesh to treat indigent patients. Sharon is past president of the International Association of Central Sterile Processing Management and attended Southern New Hampshire University. She also has fellowship status with ISHA. Sharon, you may begin whenever you are ready.
Good afternoon. It's a pleasure to be with you all today to do this webinar. I want to first give thanks to OneSource for sponsoring this educational moment. It is very important that we stay in tune and abreast to what's going on in our field of sterilization processes. So today I am doing, I was excited during COVID, so I entitled this Hyperventilating Through the COVID-19 Pandemic. And as I wrote this, I thought about the fact that when you're hyperventilating, the first thing they get you is a brown bag, and they tell you, breathe in the brown bag, breathe in, breathe out. So it's don't go get a brown bag. You need to know some things. You need to know your IFUs and the importance of EUAs. And then we're going to breathe, because together we have gotten through this. We can get through this, but at the end of the day, what you have to understand is that the fire next time, we need to be prepared so that we will not be hyperventilating at all. So the objectives today, to share ways to help your staff get past the fear of our COVID-19 pandemic. Even though we're winding down in some areas and bumping up in others, there's still a certain amount of fear that might be there. We want to understand that you, the individual, through all of this, the individual are the most important person that needs care as a frontline worker. Then I wanted to take the time to explain what an emergency use authorization is, EUA, what it means, and its importance. Then to explain the importance of instructions for use, the importance of compliance, and to obtain ways for us to relax, settle your mind, and breathe during this COVID-19 pandemic. Because at the end of the day, some of us have not taken a deep breath yet. We're sitting on the edge of life. We're sitting on the edge of our jobs. We're sitting on the edge of work, period, worried about the next shoe falling, where if we just do what we're supposed to do, we should be relatively safe. Here I have a picture. I made my team get some brown bags and start breathing in the bags, because some of them were hyperventilating. Some of them are still hyperventilating. But we wanted to just show, because we want to be interactive and have fun, that what I'm telling you is that the COVID-19 came. It is not our first pandemic. It's not the first time we've had EUAs. It's not the first time you've heard the word IFUs. So our hyperventilation may have come from the fact that we were not prepared. Plain and simple. We were not prepared, and we should be prepared. We should have been prepared. So the COVID-19 pandemic fear. We were a world in crisis, pandemic everywhere. COVID-19 didn't just stay in one place. It got on airplanes, it got in boxes. I don't know what it got in, but it came all over the world. And the reason that this pandemic was so excitable was because it didn't just do one country and we pray for other folks or we say good words and hope they get better. It actually affected the world. It brought the world to their knees. And anytime anything can come along and bring us to our knees and stop our daily lives in its tracks, that brings fear, because now you cannot predict what tomorrow will bring. Now you have to actually sit back and say, ooh, I wonder what. So we had a world in crisis. Under the world in crisis, what we had to have was communication. The fact that communication will always be front and center in everything that we do was there. You have to communicate with people, with your peers, with the team. You have to communicate with the doctors, the nurses, your directors. Communication is paramount. I found that daily updates were needed. Every day we came in and we talked about the pandemic. That's all anybody could talk about anyway. But every day we came in, I found that if you are transparent and truthful and put the cards on the table, you can help alleviate a certain amount of fear, because the fear is of the unknown. All we knew is that the pandemic was here. We were being told to stay in the house, stay at home, don't come out, don't get in your car, don't go visit your mama. We were told that we were going to be this way for a while. And a lot of us have been working for years and we have never, ever seen our jobs come to a halt. Whoever thought you wouldn't be able to go to the mall? You couldn't just run into McDonald's and order some fries. They were shut down tight as a drum. Communication and daily updates were very important, that you knew what was going on in the world, but not so much the world as what was going on in your part of the world. What we have here at the Adventist healthcare system, like many other places, is we have employee assistance programs. We had psychologists, psychiatrists on hand that were willing to talk to those of us that just could not take it any further. Because you have to understand that fear can freeze you to the point that you cannot think straight, you cannot understand, nobody can make anything clear to you. You're out there on the island by yourself. And some people actually got that bad. And some people just couldn't. I can't come to work. I'm not coming to the hospital where you all are steadily taking in COVID patients and you want me to come to work? I have a family. I have children. I can't come to work. And here we were in the field of medicine in our specialty, and they were saying, no, you all need to come to work. Here at our facility, we worked from March 1st to June 1st. We worked the whole gamut of the COVID. We had people that took weeks off, days off. We tried to maintain it so that nobody had to use up all of their vacation time at home. We were very fortunate that the organization we worked for whatever reason however you want to put it, they understood the importance of the sterile processing team, and we stayed in our area and we worked every day. Now I will tell you that we're not a trauma center, but we did emergency cases all throughout the COVID pandemic. We didn't do the 999 that we do a month. We were down to about 112 by April, May, but we did those cases. Babies had to be delivered. Patients who had been diagnosed with cancers that needed to go to the cancer center, they still needed their treatment. They could not afford to sit at home until the pandemic was over, missing those many days and hours of cancer treatment. So they had to weigh what was more important, sitting here letting the cancer continue to eat me up, or go to my treatment. Those treatments that required instrumentation to be cleaned and sterilized by the CS department still had to be processed. So we still had to do our job. That brings us to number 2. CS departments assessed their level of readiness. So the question is, were you ready? The question now is, are you ready? So to be ready, you had to know the number of trays on hand. You had to know how much stock you had for surgery. You cannot do surgical cases without packs, towels, suture. So you had to know what you had. And then came the star of the ball, which was the amount of PPE available. Who knew? And I've been in the field working in the hospital since I was actually 16. And PPE has always been out there, but boy, we never knew how important PPE was until the pandemic came to America. Now, we've had other pandemics before. We've had other problems. We've had SARS, we've had bird flu, we've had N1H1, but never was the magnitude of PPE used to take care of the patients to the point that you had none. And then we were able in the first month of this pandemic to find out how much PPE people actually had in their offices, in garages, in cars. You know, I've seen people paint houses before, but I never really paid attention to the N95s that they wore. I've seen people do different types of projects out in the world, but I never paid any attention to the N95s. So you started seeing N95s coming from everywhere. And we needed them because this particular disease entity is aerolized, and people taking care of actual patients on the front line needed to be protected from the aerolization of the COVID-19. So how much PPE you had really mattered. I would tell you that we always I say I'm not a hoarder, but we always kind of hoarded certain supplies in SPD because we always wanted to be sure we had enough. And it became most important during this pandemic when everybody wanted our face shields. You all know what I'm talking about. The SPD face shields started disappearing. The gloves started disappearing. I couldn't believe they were wearing the gloves that we usually wear for decontam because we wear a special glove. Gloves disappearing, gowns disappearing. We weren't as excited in the beginning about the mask because back in March, we were not wearing masks 100% of the time. So PPE was very important. And then the fake news. We were at home, looking on our cell phones, looking at TV, and we heard all kinds of things about the COVID-19. So you had to dispel rumors and just plain lies about what was actually going on with the COVID-19 for people who came into work every day, because they would come in every day with a different story. I heard that you can get it from touching the doorknob because it lives on the doorknob for 3 days. I mean, you had to constantly deal with people's fears and what they had heard or learned out in the community. We had to work on reevaluating the standards. Now, understand that in sterile processing, it is your job every day, whether there's a pandemic or not, to eradicate items of viruses and bacteria. That is what you do. This is nothing new. And COVID-19 did not come in and change our processes. We were supposed to be cleaning your workspace every day, every shift before COVID-19. Because you see, we deal with all kinds of bacteria and viruses. You deal with hepatitis, HIV. That was always here. And the ability for us to contract hepatitis is great when you work over in decontamination area. So our job of cleaning our areas was there 100%. What we found is that we were not doing our due diligence. or the word that I like to always use, our fiduciary responsibility to make sure that we clean our areas every day, every shift, and as needed. So the reevaluating of standards came to a process we did later on, and that's with the N95 respirator mask. But your daily duties in the sterile processing did not change. And you should have been dead on it before the COVID. And when they said COVID, you just had to ramp up and make sure that you made sure that you washed down the light switch, and that you washed off the doorknob, and that you made sure you were washing your hands. We have a process here that you're supposed to put a tray together. If you're wearing gloves, when you finish with that tray, you take the gloves off, you wash your hands, you dry your hands, you get ready for the next tray. That didn't change with COVID-19. So IFUs, it is very important, and we've been talking on the IFU sandbox. We've been in that box and on that box for years now. Because for years in sterile processing, and I've been doing this for 30 years, we just cleaned things. We were just happy as long as we had some cleaning solution and some water, and we had a sterilizer. We did what we thought was our job. I might say that a few of those years that I was out there back in the early 80s, I didn't do my best work because I didn't know what an IFU was. I did not understand instructions for use. I'd never seen them to read them. I had seen them come out of a box and we threw it in the trash, but I had never paid any attention to them. It's like when you buy a piece of furniture and you have to put it together. It's according to who's putting it together. They take the instructions, and the first thing you do is throw it in the trash, and then you throw all the screws and everything out on the table, and you try to put the piece of furniture together without the instructions. And almost 99% of the time, you have to go dig those instructions out of the trash in order to put that furniture together. Unfortunately, we were able to do what we thought we were doing best by cleaning and hopefully eradicating viruses and bacteria from instruments without reading the IFU. But as we have become educated, because knowledge is power, and as we have become professional, and as we have become more learned, we have learned that the FDA already had a mechanism in place that said that everybody that sold you any piece of equipment had to give you the means to clean it and take care of it. Who knew? Who knew? So we started getting the IFUs. And I remember when we first started getting the IFUs, because I was at a hospital that we had the Joint Commission come in, we got big binders and we started putting them in the binders, and we never could find the IFU but maybe once or twice, because somebody would either leave it out of the binder, throw it away, or put it in the wrong section. But the IFU allows you to understand your process for using the instrument, for cleaning the instrument, and for sterilizing the instrument, for cleaning any equipment that you're dealing with. That's very important when we're telling you to clean your department every day. You have to know how to clean the stainless steel tables against how to clean something that isn't stainless steel. You have to know if the cleaner you're using is multi-purpose or if it's specific. These are things that you learn in the IFU. And we will never be able to stop saying we don't have to talk about IFUs anymore, because every day somewhere in somebody's hospital, somebody processes something without following the IFU. And what you have to understand is that if you process something without the IFU, you have the ability to process it wrong. And if you process it wrong, you are giving the patient something that is not only not cleaned according to the IFU, not processed or sterilized. Therefore, you're giving that patient an unsterile item. And we work for the patient. So something came up in this pandemic. My goodness, it's called the EUA, Emergency Use Authorization. And the FDA has always given out emergency use authorizations whenever needed, whenever there is a public emergency, and this pandemic fit that bill. Whenever there's a public emergency that requires that everybody walk the same walk They have the ability to tell you how you're going to do something. And I decided that this pandemic for us was a war. And we should have been prepared, because you prepare for wars before the war comes. You don't wait until they come on your borders with all the war equipment and start learning how to use it. This is preparation before. So we should have been prepared. But what I found, and the reason I like to share with you all, my team members, a lot of us had never heard of an EUA. We didn't know what an emergency use authorization was, and people were running around saying, "Did you read the EUA?" And other people were saying, "What's an EUA?" So when you tell me what's an EUA, I know you haven't read one. But they came out starting in March, right after they told you to stay at home, don't come out, shut the door, it's coming. The FDA realized, due to what was going on in other countries, China, Italy, that the PPE was going to be a problem. As hospitals started becoming full of patients with the COVID-19, and you put on an N95 and you throw it away and put on another one and throw it away, and then we started looking around and saying, we don't have that many N95s. We don't have that many face shields. We don't have the gowns to put on people. We started realizing, as hospitals and emergency centers, we weren't going to be able to keep up. And this got back to the FDA, and the FDA said, we have got to do something about it. So they came up with an emergency use authorization, which is a guidance to what you can and cannot do for critical medical products. And what you have to understand is that there are EUAs for everything. Not just N95 respirator masks, they're EUAs for ventilators, they're EUAs for gowns, they're EUAs for gloves. They put out what the rule for the United States would be with the products we needed to use. And an EUA is temporary unless they go back and make it permanent, meaning that at some point in time, they will come and tell you to cease and desist what we allowed you to do during the war. Critical to us in sterile processing areas, hospitals, emergency rooms, ORs, was the EUA on PPE, because we had to be sure we could meet the need of our frontline workers. No one should have to come to work and not have the equipment needed to do the job they have to do that could in turn harm them. So under the EUA authority, the FDA evaluates the request for authorization very quickly using the evidence that is available. Now understand, we didn't have lots of evidence about we're going to shut the world down, but we did have some evidence of what could come. Some people had already seen the writing on the wall after SARS and after Ebola and after N1H1, and they had started working in their little areas on what would we do if this happened. And so the FDA didn't just wake up one day and say, do this. People and groups had been working on this. So when they came up, they were able to carefully balance the risk and the benefits of the products that they were going to ask us to change our process on. And that's what we have to understand. And we, the end user who was going to have to do the process, we needed to be able to understand that what we were doing was covered as long as you followed the instructions for use that came with the EUA. We were covered for the process we were going to use. So I talk about breathing. People needed to sit back, chill, take a breath, and understand that in the case of N95 respirator mask, which we were asked to process, that we were following the guidance of the FDA. No hospital just hopped up and started making its own rules. Most hospitals, if they were systems or standalone hospitals, had to get together and take that deep breath. And the first thing they had to do is read the EUA, understand the EUA for N95 respirator mask, and then set a policy. You cannot just go and say, as of today, we're going to start opening the window to SPD and leaving it open. You have to come up with the group that includes your infection control team. and say, what are we going to do? What are we going to do at this entity? So policies were very important. I can tell you that here at our hospital, we got our group together, our IP group that was made up of infection control, the different departments that were going to be infected, all of the professionals, the administrators, to say we need to come to an agreement as to what we're going to do. We need to go ahead and come up with a policy. We came up with a policy according to the EUA that came out in March for processing an N95. You may say, Ms. Golden, why do you say the word processing? N95s come in a box unsterile, like any other mask that we've always pulled out of the box. You pull it out of the box with your hand and you put your mask on. Now, as people got excited about N95s and who touched it and who did whatever, I had to remind people that you've been pulling N95s out the box all the time and putting it on your face. You never paid attention to who pulled the one out before you. You didn't ask them if they washed their hands before they touched it. You didn't ask them if they washed their hands all day long. You just went and got yours, and they didn't ask you. So we had things going on. People start thinking outside the box when it may affect your livelihood or your well-being. So we had to come up and understand that process. The N95 comes unsterile. Doesn't need to be sterile. What the EUA for processing and then reprocessing an N95 respirator mask did was it gave us guidance as to what we could and couldn't do. You can't wash the N95 respirator mask. So for those of us in the sterile processing profession, it made us stop and take a deep breath, because we've always been told, and one of the big rules, other than if it isn't clean, you cannot sterilize it. The new one was, if it has not been cleaned, you can't put it in nothing. And if it is a single use, SUD, a single use device, you can't go and start processing it. That's against the rules. And you're absolutely right. It's against best practice. It's against recommended practice. It's against the AORN, evidence-based practice. It's against AMI. It's against everything. But I told you earlier, we were in a war. And when you're in a war, the rules change. The lines move. Things change. And so we were in a war, a pandemic war, COVID-19, and the rules changed. And now they said, you don't have an N95, but we can eradicate it of the COVID-19 virus and other bacteria and viruses. And we can do that. First off, they came out with, we can do that by putting it in, for us, the STERRAD. STERRAD came out first. ASP came out with clear rules, step by step, on how to process an N95 in their machines using their gas plasma. And for us, because we needed to take care of the frontline staff, after the policy was written, the next thing we did was set ourselves up to go ahead and start that process. We got the policy written. We got the flyers ready for the frontline staff, because you should never start anything new and not tell people what's coming. It is very important that you be transparent. We told them why we were doing it, how we were doing it, what they needed to do to help us do it. We told them what our choices were. This process, no N95. You need an N95. We got all these patients in the hospital. So besides putting up walls and doors and making COVID units and getting PAPRs, buying PAPRs, trying to find PAPRs, trying to find N95s, we realized at some point we hit the wall. We couldn't get anything. So we set ourselves up to become processors of used N95 respirator mask, following the EUA that was put out by the FDA. Now, EUAs change. And as you go along, as things change, as they learn, as I told you earlier, it's something that they learn, they may change an EUA. And so you not only need to know what an EUA was, You needed to be cognizant of the fact that they changed. And as the SPD manager or director, it is your job, still was your job, to stay abreast of any new EUA. They've changed the EUAs every month. If you go on the website under the FDA for EUAs, you'll see the EUA for March, April, May, June, July, August. So it was that important. About 2.5 to 3 weeks after ASP said you can do this in our machine, the FDA gave clearance to Steris that you could do the mask in their machines because we were desperate in this United States. And as long as we followed the clear guidance that was given for those machines and those processes, we were okay. And we were frontline workers in the sterile processing departments, getting things ready for our frontline team members who actually stood over somebody's bed, who actually helped to intubate a patient, who actually took care of a patient with COVID-19. And that required a lot of breathing, but not breathing in a bag. Now, we had to deal with people coming to work who had to maybe wear those N95s, who had to send us those N95s, and everybody was excited. So it was very important that each person took time to take care of themselves, because when you're sick in your mind or your body, you cannot take care of anybody else. And I find that the one thing you have to understand is who is important to you. And the most important person to me happens to be me. And I talk positive to myself all the time. You know, I tell myself, you're good. You do the right thing. You have integrity. You stand for what's right. I talk to myself all the time about the good things. I also talk about bad things, but I understand that I am important to me. I take time to stop and reflect on what's good and what's right for me. I stay at the house with my daughter and grandson, and we happen to be in a condo, a house that has 3 levels, and I stay on the bottom level, and I stayed on the bottom level. I came in, I had to take my clothes off at my door. I had to drop those, go into the shower, take a shower, wash all of that off before I could come and even go to the top of the stairs to talk to the family. In fact, for a long time, they would talk to me via the telephone. They didn't even want to see me. They just wanted to talk. Everybody wanted to stay away from everybody because I worked at a hospital. And I wanted to be sure that I did not give my family members anything. I did not want them to get sick from me. So we had to change how we even communicated. We had to understand that if you're healthy, mentally and physically, you make the workplace easier to deal with. And that's important, because if we all come in sad, depressed, despondent, and not understanding COVID-19, I'm scared to come to work, and why should we come to work? The man at McDonald's isn't being made to go to work. You're in the medical field, and different rules, different rules. We don't have to have a quarter pounder with cheese, but the patients do need your help if they're going to have surgery. And patients were having surgeries. Mothers were having babies. So we had to come to work. We also had to understand that with this COVID-19 came something that was called some more stress. We have stress in our lives anyway, but now here came some more stress, and stress will kill you mentally and physically. So we had to think about that and work on that and understand that we had to be mentally stable. I had to come in every day, and at our get together formation every morning, we talked about COVID-19. We were very transparent. People asked questions. We gave truthful answers. We didn't make anything up. Any answers we didn't know, we asked administration, what is the answer? Why do I have to come to work? Why can't I work from home? You know, because a lot of people started working from home, but those of us that are frontline workers in the hospital, we can't take care of the patient at our house. So we had to come to work. We had no choice. And then people were worried about themselves. What about my PTO? You're sending me home? You're telling me not to come to work for a week? What about my PTO? What happens when I don't have any PTO when this is over? So people were also concerned about themselves, which they should have been. We should have been able to talk about how do we help each other. You know, one of the hardest things to do in the sterile processing was social distance. It's hard because our places are only so big. You measure all 6 feet, and somebody's almost standing out in the hall where they can't put the tray together in the hall because we're in a special place. But as we took deep breaths here at this hospital, we were able to look at something very important that allowed us in our transparency to sit back, take a deep breath, and say, you know, it's not so bad here. We were in sterile processing, which a lot of people don't even know exists or where we are. But in sterile processing, we have air exchanges. We were one of the only departments, other than the OR and the other units that have surgical services, where we have air exchanges. Our air is circulated 12, 18 times an hour on the clean side, at least 10 to 12 on the dirty side. And so we were safe and we were in lockdown. People couldn't just come see us. They never have been able to, but we were most happy at this time that they couldn't come and see us. We were able to sit back, be calm, take that deep breath. I tell them every day, you're in the safest place. This is before we started masking up 100%. The people did ask, can I put on an N95? We didn't need an N95 in the sterile processing department. We were not doing direct patient care. And we had air exchanges. So we were able to just keep calm, take that deep breath. We were able to sit down and breathe in through our nose and breathe out through our mouth. These are things we had to do daily because we'd come in some days more excited than others. As someone would take care of a patient in the OR and the patient had COVID, our hospital set up a whole COVID unit and they'd call and say, ooh, the patient had COVID, we're bringing the instruments. And I have to be truthful and transparent and tell you, I had some people got excited. They bring in the COVID instruments. What are we going to do? We're going to clean them. How are we going to clean them? Well, let's look at the IFU. Did it say anything about special bacteria and virus? Or does the IFU say it kills viruses? The one thing about COVID is that it is easily killed on equipment. It's easily killed. And if you ever picked up a bottle of the Clorox wipes and read the back of it, human coronavirus was already stamped on the back as something it was killing before COVID-19. So what you need to be sure is that what you had would kill the viruses. And so we didn't have to do anything special. You need to put on all your PPE like you were asked to do before. You know, before COVID, when you were just cleaning HIV, hepatitis, just nasty stuff. And you went into the decontaminant with one glove on and half of a shoe cover, and you were okay. I had people that said, I can't come to work anymore because you got COVID. I said, but you were happy in here with hepatitis. I don't understand. What you do matters, and you were supposed to be cleaning viruses and bacteria all the time. You have to understand within the process of not being hyperventilating and being excited that the work you do is here. So we couldn't be so excited and say, you know what, I don't know if I can take this. Because I'm here to tell you that if you don't come tomorrow, the work will still get done. Nobody gets out of this life, out of the life alive. You know, to be real and to be transparent, we're all gonna die. I just didn't want to die early or sooner than I needed to. But you can't avoid dying before your time. And you have 100% control over your response to what life throws your way. And nothing can explain that more than COVID-19. As the rules came out and they said, put the mask on, as hospitals went back to the drawing board, and as the FDA and as the CDC and as the World Health Organization, as everybody got together, as we started listening to Dr. Fauci, as we started listening every day, the one thing they started coming out with is they said, you know what, this is sterilized, people. What we find out is that the reason we wear masks in surgery is to protect the patient from us. And they said, if you put a mask on, you protect the person from you. They put a mask on, they protect you from them. And we came up with the policy that said we would mask 100% of the time in the hospital unless you were eating or in an office or in the wherever by yourself. And so people had to go and get masks. Now, some of the hardest people to get to follow the rule happen to have been medical people who were scared before scared about the virus. You couldn't get a mask on their face. Why do I have to wear a mask all the time? Why do I have to do that? It's because that's the rule. And you want to protect people. And this particular disease was killing people rampantly, and you couldn't go visit them. Families lost family members. They never got to tell them goodbye. They never got to say, I love you. And that's just bad. So to put the mask on wouldn't hurt us. So within the hospital, even within the sterile processing with our air exchanges, they told us, take that deep breath and put your mask on and keep them on. When you come in the hospital now, you have to have a mask on. After you have your mask on, you have to take your temperature when you come in. You have a whole little survey you fill out every day before you clock in. In case you're already sick, they don't want you to clock in and clock out. We do all of this before, and then we come in to take care of the important people that are here, which are our patients. And for sterile processing, we take care of the patient and our team members who happen to be the frontline workers. So processing N95 masks became a common thing for us. But I will tell you, as soon as the government gave Battelle the go-ahead, the green light to take over the processing of the N95 mask, we signed up and got on board, and we started sending our N95 respirators out of the hospital to Battelle. We were using gas plasma. They use VPHP. They use a different process that had been cleared, and they have been working on this process since 2014. They didn't just wake up on COVID and start coming up with it. They had been working on it. So when the FDA gave the Battelle process clearance, it was a clearance that they had been looking at for years. So they were easily able to give them the clearance. Other than the other studies that have come out since then, there are studies about food dehydrators, microwave ovens, all kinds of things that they say you can do. But what you want to do when you're taking care of frontline workers and patients is you want to be sure that whatever process you deem to be cleared has truly been vetted and cleared by the FDA and is part of their emergency use authorization. We got a bunch of stress balls, and I've squeezed a few during this pandemic myself. Stress balls help us to take a deep breath in and take a deep breath out. But what I found as we go along and as we get to the end of this particular webinar is that you have to find in your mind or in your life when you're stressed and when you're put upon with disaster, things to think about, the good times. You have to remember some good times. And so I'm going to take you through here for just a few minutes, some good times that I found that got me over, because I can be strong, but I had my doubts as I went home every day and went downstairs and went in downstairs to where I stayed, and my family was upstairs talking to me via phone. I had to find some good times, because one thing about the COVID-19 is that it made you isolate, and human beings are social animals. We do not like being by ourselves. As much as some of you all say, oh, I don't mind being by myself. You don't want to be by yourself for every day, all day, for weeks and weeks and weeks. Remember, I told you March the 1st to June 1st. That's too much of by myself. The reason why they have solitary confinement in jails is because that's a punishment. Human beings don't like to be by themselves. So I found some pictures you'll see on the screen of things that I did before COVID-19 in Montana. These two pictures, I'm in Montana looking at the snow-capped mountain, looking down on the road below me, wondering why I was in a car up on that high up in the mountain looking down. As I look at the pictures now, and as I looked at them then, I was wondering about my sanity. Why was I up there? But anyway, the beauty that I saw when I was up there in the moment was pleasing to me. I went out on the boat. I love sunsets and sunrises. There's nothing better than a sunset and a sunrise. The sunset is And sunrise here is in the Philippines. The sunrise here is in Zanzibar, Tanzania. I'm back on that mountain, wondering what's wrong with me. I went to the Philippines and went to see a volcano that they told me was dead. It erupted a year later after I left. It was bubbling while I was there. But these are things I went back and looked at to calm myself down during the COVID so that I could be focused on taking care of our patients and our frontline workers. I wanted to be sure that I took care of understanding IFUs and EUAs, and I stayed on top of it. I didn't want to hear 2 days later that the EUA came in and changed, and I was still doing what I shouldn't be doing. Kathy Dempsey is the author of Shed or You're Dead, and she says we must take care of our bodies because where else are we going to live? So if you can't think of anything else about wearing a mask, and I'm tired of wearing masks, and I'm tired of being by myself, I'm going to the picnic, just remember, you have to take care of your body. And in taking care of your body and yourself, you help us to take care of other people. Remember, you have to breathe in order to live. And we have to breathe through adversity. We have to breathe through pandemics. This is not the last pandemic. There will be a fire the next time. But hopefully, when the fire the next time comes to America, we will be prepared and we will be able to take that deep breath and say, we have PPE, we know what to do. We may not be processing N95 respirator mask because we will have found a different way of doing things. We will have enough product. What we will be ready. I have this picture of a frog because I say it's a sad frog that does not enjoy the pond he lives in. I'm very happy with the group that I got to work with here at Adventist Healthcare and how we took care of our frontline workers. And I'm very thankful for OneSource for sponsoring this webinar. And I'm done. Thank you.
Thank you so much, Sharon. That was a great presentation. We've got just a few minutes where we can get to questions that came in throughout the presentation. I'm going to go ahead and start with the first one. How did your staff deal with having to work through COVID-19 without wearing N95 respirator masks?
My staff, because of the transparency we had every day, as I came in and told them what we were going to do, why we were doing it, why we weren't going to do it, they were pretty much okay when I explained to them, you're in sterile processing with air exchanges. And so they were okay. Now, I did have a few people that work in endo that came running because they got some information. Remember, I told you about that fake news and wrong news, and somebody told them, you can't work in endo unless you have an N95 on. And they came running. We need an N95. And I asked them why. And they said, because I was told. And I said, but you've been cleaning virus and bacteria in the little endo all the time without one. And you have air exchanges in that area. And so after explaining my team, that team, they understood, and they understood that you wear N95 when you're going to have direct patient care. We told people, because at that particular time we still had one, it's only a few people in the endo unit, if you just got to have one here, but you're going to have to get it reprocessed. But my team as a whole, they were okay without an N95.
Okay. Next question here. Did you have any staff members refuse to come to work because of the COVID-19 patient presence?
You know, I have 24 team members, and I had one team member that refused, may be a harsh word. She just had a baby, and her baby was young, and she was so fearful that she would take COVID-19 home to her baby that she just could not come to work. What we did do is we worked with her through human resources, and we allowed her to be off. And by her being off, it allowed my team members as a whole on that shift, they didn't have to take as much time off because we had an FTE that wasn't coming in. But we did make it clear to her that this is a medical field and this is a medical service, and you are expected to come to work. And what I had to say to her was, when and if I call you and say, okay, we need you to come in, she was either going to have to come in or she would be relinquishing her job. But fortunately, we got through March the 1st to June the 1st without her, and she has since returned. She was very scared the first few days, but she's since gotten herself together, and she's okay.
That's good to hear. Okay, we have time for one more question. How did you justify processing N95 respirator masks knowing they were single-use devices?
I took the time to know best practice, recommended practice, and the rules of SUDs. Then I read the EUA, and then being on the committee here at this hospital that made the decision that we would do this service, I got on the team 100%. I was actually the Battelle facility that opened up here in DC. I was the first manager of an SCD that showed up, got permission to go and watch the process before they ever did a mask for us. I wanted to be sure I understood the process, that I saw the process, that I understood how they received them, how they checked them, how they processed them, how they sent them back before I sent one N95 for my frontline team in. Because the one thing I wanted to be sure to be able to say was that I sent your N95 in and I sent mine too. And if I have to put one on, I will be putting on the processed N95 that went to Battelle. So I would not put anything out in the system for my frontline workers that I would not use for myself. I'm here for the patient and I'm here for the frontline worker. So with the EUA, the FDA cleared guidance, I felt secure in following the process, following the instructions for use as I did the process, and I was okay with it.
Excellent. Well, thank you so much, Sharon. If we didn't get to your question today, please rest assured that Sharon and OneSource will get a copy of the question submitted and can follow up directly. Thank you again, Sharon, for a great presentation. I'd like to encourage everyone to visit today's sponsor to learn more about their products and what they provide our industry. You can learn more at onesourcedocs.com. A quick reminder, you can obtain your certificate by completing today's post-webinar survey. The survey will be emailed 1 hour after the completion of today's webinar. You must complete the survey in order to receive your CE credit, and you will be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We will be back next week with another webinar. Visit ortoday.com/webinars for more details and complimentary registration. Thanks, everybody, and we'll see you next week.
All right, let's do this. Let's come out of here. Come out.